So today we'll be talking about ASOM, acute suppurative otitis media. It is also known as AOM, that is acute otitis media. It is an acute inflammation of the middle ear by pathogenic organisms and is usually seen in infants and children, also lower socio-economic group. Right. It is seen more common in infants rather than adults because in infants we have a wider and a shorter eustachian tube, so they are more susceptible to infection. Right? The most common organism for causing the ASOM is pneumococcus or streptococcus pneumoniae, which accounts for about 30% of all the cases, and then we have Haemophilus influenza, which accounts for about 20% of the cases. It is important to note that most of the patients present with a history of sore throat, that is pharyngitis, or upper respiratory tract infection. Now, the patient usually presents to the clinic or OPD and they say they have been suffering from sore throat, they have been suffering from upper respiratory tract infection for about 7 days, and then now suddenly they have earache, they can't hear properly, and they have severe fever. Now these all point towards ASOM. Okay, so how does the infection spread from the pharynx to the middle ear cleft? It usually spreads from the eustachian tube. Right, it is the main route of infection. Okay, now when the causative organism passes through the eustachian tube, they cause edema of the eustachian tube and it leads to tubal blockage. It is also known as stage of tubal occlusion. And since normally the eustachian tube performs two main functions of ventilation and maintenance of pressure, when the eustachian tube is blocked, both these functions suffer, and we see a negative pressure built up in the middle ear cleft in contrast to the external positive pressure. The tympanic membrane gets retracted. After this, the causative organism causes inflammatory response in the middle ear cleft mucosa, and we see hyperemia and congestion of the middle ear mucosa. When the clinician examines the tympanic membrane with their otoscope, what they see is a red congested tympanic membrane and the classical cartwheel appearance of the tympanic membrane. Okay, let me show you what I'm talking about. Here, classical cartwheel appearance. You can see the strias, so it looks like a cartwheel, so it is known as the classical cartwheel appearance of the tympanic membrane. Okay, then after some time there is exudation and pus formation in the middle ear cleft. Now since there is no way for the pus to go out or drain, since the eustachian tube is blocked, it exerts pressure on the tympanic membrane, and tympanic membrane bulges out towards the external auditory canal. This stage is known as stage of suppuration, and after this there is a perforation in the tympanic membrane and the pus comes out, and with the pus coming out all the symptoms subside and there is stage of resolution. The patient feels relieved with the perforation in the tympanic membrane. Now normally there is resolution of all the symptoms and signs, but in some cases there is lack of normal body repair, or there is low immunity, etc. So there can be complication, and it is known as stage of complication. Okay, so let me just tell you what I was talking about in quick summary. So there is infection of the pharynx that affects the eustachian tube. We see tubal blockage, there is edema, and the tympanic membrane is retracted due to negative pressure inside the middle ear. This is known as stage of tubal occlusion. Okay, in stage of presuppuration, there is hyperemia of the middle ear mucosa. We see red congested tympanic membrane and cartwheel appearance. There's cartwheel appearance of the tympanic membrane. In stage of suppuration, there is exudation of the fluid in the middle ear and pus collects in the middle ear. Okay, the tympanic membrane bulges out. It is also known as impending perforation. Okay, after this stage, then we have stage of perforation or stage of resolution. The tympanic membrane perforates, the pus comes out in a pulsatile fashion. It is called as pulsatile otorrhea, and it is also known as lighthouse sign. Okay, since lighthouse also appears after a certain interval of time. Okay, the most common site of perforation in ASOM is seen in anterior-inferior quadrant of the tympanic membrane. Now, as you can see, this is a right tympanic membrane, which we can tell by looking at the upper tilt and the cone of light. So, the perforation is most commonly seen in the anterior-inferior part here. Okay, and then there is relief from the symptoms the patient comes up with. How do we manage a patient of ASOM? It is very easy. So how do we manage a patient of ASOM? Okay, if the patient presents to you in the pre-suppurative stage or in the early suppurative stage, there is hyperemia, there is congestion, and there is little pus formation, but there is no bulging tympanic membrane and there is no impending rupture, then we can simply go for antibiotics. That is like antibiotics like ampicillin or amoxicillin, and we can also give nasal decongestants. They can be oral nasal decongestants or nasal drops. Okay. We can also give analgesics and antibiotics for pain and fever. But if the patient presents to you with impending rupture, that is, the tympanic membrane is bulging out and is filled with pus, then we can opt for myringotomy. Myringotomy, as the name suggests, myring means tympanic membrane and otomy means making an incision or an opening. So we are making a small opening on the tympanic membrane. For this procedure, we give a curvilinear J-shaped incision on the posterior inferior quadrant of the tympanic membrane. Okay, and then we let the pus come out, pus drain. Okay, the tympanic membrane will then itself heal and the patient is relieved of the symptoms. We can also follow myringotomy with antibiotics and analgesics as well. Okay, so that is all about ASOM.